Good evening, and thank you for watching CAN TV. I'm Anthony Walker, Community Liaison for A Touch of Grace Hospice, and tonight I'm joined with Leah Lewis, our social worker for the faith team at A Touch of Grace Hospice. You are watching CAN TV 21. We are a live interactive program. We will be with you for the next 25 minutes to answer questions pertaining to hospice care. We have partnered with CAN TV to educate on the benefits of hospice care. Our lines are now open. That number is 312-738-1060. That's 312-738-1060. But before we begin our discussion with Leah, I would like to review some key facts regarding hospice care. Hospice is a form of care that is provided for individuals who are declining in health or terminally ill. It is prescribed by a physician. It is covered under HMO, Medicare, and Medicaid insurances. One of the unique things at A Touch of Grace, if your loved one does not have those insurances, we will see to it that they still receive the benefits of hospice care. Hospice provides a number of different services to bring comfort to your loved one, from nursing care, social worker, hospice aides, in some cases even a homemaker, chaplain services, and volunteers. Hospice can take place wherever your loved one is, be it at home, a hospital unit, a nursing facility, wherever your loved one is, that's where we will go. If you're just tuned in, again, we are a part of CAN TV tonight. We are A Touch of Grace Hospice. A Touch of Grace Hospice was developed about 7 years ago with a vision from Dr. Jennifer Moore, who saw the disparity in services in communities of color. So one of our goals is to educate the community before there is a crisis. We do believe that if more people knew about hospice care, more people would utilize that services. So that's why we're here tonight. Again, our lines are now open. That number is 312-738-1060. If you know someone who has questions about hospice care, or if you want to become a little more familiar with the Touch of Grace Hospice, we encourage you to visit our website at www.touchofgrace.net or give us a call. Our phones are open 24 hours of the day, 7 days a week. That number is 708-499-3400. Leah, thanks for joining us tonight. Now, you are the social worker for our faith team. Mm-hmm. Would you explain to those who are watching who may be a little confused as to what a social worker actually does? Could you share with us what you do for us at A Touch of Grace?
For hospice, social workers tend to provide support to the families, educate the families about different resources that are available to assist with caring for the patient, assist with completing applications for various programs like circuit breaker, public aid, things of that sort, different foundation grants that might be available to assist the families financially with caring for their loved ones, along with just about everything that's non-medical, including advanced directives, teaching them about funeral arrangements and assisting with making funeral arrangements, facilitating family meetings, you name it.
Okay. So you're really that buffer, if you will, for the family when they need to negotiate different possibilities as far as care for their loved one. You touched on briefly advanced directives. Could you go into greater detail? Why do you think we don't know enough about advanced directives?
Well, people have a tendency to want to delay even discussing advanced directives because they feel like if they get their affairs in order, that means that they won't be with us for long. But it's very important because if you haven't designated someone to make decisions for you, to act on your behalf, then if something happens where you cannot make decisions for yourself, then you're going to run into trouble.
Absolutely.
So it's important that you designate someone, that you talk to that person about what it is that you want done, and make sure that they are on board with what you want done and are supportive and are willing to do whatever it is you need them to do in spite of what others have to say.
You know, I'm out in the community educating all the time on the benefits of hospice care. And one of the fears that people have is the word itself, hospice. They feel like if they sign their loved one up for hospice, or if they talk about hospice, that means that they're giving up. And they never take it even beyond that as far as advance directives. Some of the advance directives, are one of them that I would like to touch on, is a do not resuscitate order. What exactly does that mean? Does that mean that, what does it mean? You'll hear the term do not resuscitate, but what does that mean?
Really what a DNR means is that you've decided that if your heart stops beating and if you're no longer breathing, then you don't want the doctor to take extreme measures to bring you back.
Okay.
You want them to allow you to go naturally. So no CPR, although sometimes some people do opt to get CPR, and that's called a DNI, do not intubate, and also no life support.
Now, you said that's a DNI.
A DNI is when you do want to have CPR done as your heart is slowing down, but you do not want to be placed on life support. So it's a do not intubate.
Wonderful. A lot of people have been told that one has to have a DNR for hospice care. Is that true?
No, it's not true. A lot of patients, when they come on hospice, are not comfortable or not ready to make that, to do that. So you do not have to have a DNR in place when you are admitted to hospice. It's something that we will continue to work with families on, educate them about the pros and cons of whether or not CPR is something that might benefit or harm their loved one.
Okay. Now, tell me, what really brought you to the hospice arena?
Honestly?
Yes? Viewers would like to know.
Well, I used to work in dialysis, and it seems to be a natural transition from dialysis to hospice. I don't know why, but it just seems to be that way. And I've always enjoyed working with senior citizens.
Okay.
And a lot of the patients on hospice are older. And so it gave me an opportunity to really get to spend some quality time with them as they are making their transition.
Okay. If you have just tuned in, you are watching CAN TV 21. We are a live interactive program. We encourage you to call us even now. Our lines are open. That phone number is area code 312-738-1060. We are Touch of Grace Hospice. We're here to educate, take your questions. Maybe you have a testimony that you would like to share about your experience, your positive experience with our hospice services that you've worked with. I would like to share this statistic with you, that only 8% of individuals who actually qualify for hospice care and are African American actually use those services. Other groups, European descent, for example, are using it at much higher numbers. So that's one of the reasons why we're here, to educate on the benefits of hospice care. Again, hospice is covered under Medicaid, Medicare, and private insurances. So there's never any out-of-pocket expense to you or your family. I'm here with Leah Lewis, our social worker, and I'm Anthony Walker, the community liaison. And my job is to educate the community at large on the benefits of hospice care. So you'll find me here on CAN TV every Tuesday night at the 6:30 hour. So if you have a neighbor, have them tune in and watch. Let's continue our conversation with Leah Lewis, our social worker. Now, Leah, what about respite care? I know you're pretty active with that when our families require that. Would you explain that whole process, and what is respite care?
Respite is a program that's offered for hospice patients. It allows families to get a break. At a Touch of Grace, patients are entitled to a respite stay once every 4 months.
Okay.
And it's 5 nights in a nursing home. So it gives the family members an opportunity to go on vacation or just rest and relax, knowing that their loved ones are being cared for by someone else. And then also the Department on Aging offers respite. They will allow a patient to either go into a nursing home for, I believe it's 6 or 7 nights, or they can receive 80 hours of in-home homemaker services. So it allows caregivers, again, to get a break. A lot of times people choose to use it on the weekend or maybe in the evening so that they can take care of some things that they need to get done.
Wonderful. I know our families have benefited greatly from respite care. One of the issues that a lot of our family members do have is they are the primary caregiver. And
Sole caregiver.
exactly. And if the caregiver cannot take care of themselves, it's really impossible to take care of their loved one. A lot of times, especially in the African American community, when we have someone who is ill, we wait to the last minute, sometimes the day, before we sign our loved ones up for hospice care. Whereas our loved ones can benefit from all of the services that hospice provides for much longer periods of time. Usually the doctor will prescribe hospice generally about 6 months out. However, we know that the doctor's not God. So the doctor can say one thing, but God will say something else. So some illnesses can go on for much longer periods of time. So during that time, we can support not only the individual who's terminally ill, but the family as well. There can be a lot of drama that goes on within our families when someone is ill, not only emotionally, spiritually, mentally, and even financially. So we encourage you, if you know someone who could benefit from hospice care, maybe within your family, maybe it's a neighbor, maybe it's a church member who's been ill or declining in health, they have a right to have those supportive services in their home. One of the things that I share a lot, Leah, is there's nothing like my own pillow, nothing like my own remote control. So I understand the benefits of home, and a majority of our family members, our patients that we serve, are in the home. Again, you are watching CAN TV. Our lines are open. That number is area code 312-738 1060, or you can visit us at our website. Our website is www.touchofgrace.net, or give us a call if you have any question. No question is too elementary. That's 7 days a week, 24 hours of the day. That number is 708-499-3400. Leah, I also want to touch on pre-planning. That is something that comes up. You have a loved one who's terminally ill, and I'm always amazed at how our families have never had the discussion with mom or with dad. What would you say to individuals regarding pre-planning?
That it's a conversation that really needs to be had sooner as opposed to later. Family members really need to share with, or I should say patients really need to share with family members what it is that they want done. And I always encourage patients to call up as many family members as they can so that everyone's present when they let them know exactly what it is that they want done. And then once that's been indicated, I encourage families to contact several different funeral homes because there can be a large variance in price and services.
Sure. So they really should shop around.
They should shop around.
Okay.
They should.
Okay. Again, give us a call at area code 312-738-1060. And I do believe we do have a caller on the line. Caller, what is your comment or question?
I got a hospice in May for my husband.
Okay.
And I'm a nurse's aide myself,
Okay.
but when my husband took sick, everything, whatever I've learned or whatever just went out the window.
Okay.
But, they came in and, took care of everything. I didn't have to worry about nothing. It put me at ease.
Wonderful.
And, he was gone in about a week. But, just watching this program, it just, it just brings back, I didn't know all the help was out there.
Okay.
And, they really helped me so much. And they still keep in touch with me. He died May 20th.
Okay.
They still keep in touch and ask me how I'm doing. And I think it's a beautiful thing. It's just a beautiful, I can't even, say much. I just know it's just a beautiful thing.
Thank you so much. Thanks for calling. And you hang in there, okay?
I will.
Okay.
I will. Thank you.
Thank you. And that's one of the testimonies of a lot of our family members. And I say this all the time. If you work in hospice, it's really more of a ministry. It's not a job. We touch individuals in ways that go way beyond even my imagination. And you need that type of support. when you are dealing with a challenge of someone who's terminally ill within your family. Hospice care, especially at A Touch of Grace, we go way beyond just that immediate situation. We offer a celebration of life, which celebrates that individual who has passed on. We also have a 24-hour prayer line, on which I'm part of that team, where our family members can call in for additional support. We are culturally sensitive. So if you have another testimony like that caller who just called, or if you have a question regarding hospice benefits, would you give us a call right now at area code 312-738-1060. That's area code 312-738-1060. One of the other things that I do is I'm in the churches. So I welcome the opportunity to come to your local church or auxiliary and educate on the benefits of hospice care. And Leah, you know what I do when I go? I take a little snack or a little lunch, depending on the situation or how big the group. And I have a wonderful time. It's an opportunity for me to educate and for your parishioners to receive information in a non-threatening manner. Of course, when someone's terminally ill, at the hospitals, the social workers are speaking, the nurses are talking, the doctors are speaking. There's a lot of information to try to digest at a very critical time, and time is of the essence. By allowing me to come into your churches and speaking on the benefits of hospice, a person can relax and we can interact and we can really talk that thing out regarding hospice care. So I encourage you to give us a call at our website or visit our website at www.touchofgrace.net or give us a call at 708-499-3400. Again, we are still live. That number is 312-738-1060. Leah, as you are educating the families on hospice care, and I know there's a lot of different areas that you have to educate our families on, what is one of the misconceptions about hospice care that our families
that it means that their loved one is going to die immediately. People tend to associate hospice with last days, last hours. It doesn't occur to them that sometimes people actually get better with hospice care. We've had many patients that improve with all the extra care and attention, to the point that we actually had to discharge some of them, and you'd be amazed. As much as people fight to stay off of hospice, I'm amazed at the way people fight to stay on hospice once they've experienced it.
Because we really do connect with the families. And we do become a part of that unit. One of the things that I really appreciate about A Touch of Grace is that once a worker is assigned to a family, they stay with that family. So you don't have different workers coming in all the time. You really do get familiar with the worker who is working with you. And that could be the nurse, it could be a hospice aide, it could be a homemaker, the chaplain even, or a volunteer. So if you know someone who could benefit from hospice care, please consider A Touch of Grace Hospice for those services. Now, as a social worker, because that's what you do, as a social worker, what would you say to individuals who still fear the challenge of allowing or even exploring the possibility of their loved one being on hospice care?
To try to be open-minded, to give it a chance. Hospice is a service, so if you do not like it, you are more than welcome to cancel that service. But again, if you would just give it a chance, I can't tell you how many families say to me, I didn't know this kind of service existed. I wish I had known a long time ago. I needed this help so long ago. I've had friends that took care of their family members and they were exhausted, and had they known, this would have been so helpful to them. So most that come into contact with hospice only have positive things to say.
Wonderful, wonderful. Again, we encourage you to visit our website at www.touchofgrace.net or give us a call, 708-499-3400. If your church would like me to come out and do an in-service or have a discussion to educate on the benefits of hospice care. If your block club would like me to come out, maybe your business would like me to come out to speak on the benefits of hospice care. Again, I offer refreshments and lunch. You can't beat that. And you're also being educated. One of the things that we have discovered that employers lose a lot of dollars at the end of their bottom lines when workers have to take off time to care for a loved one. But if your workers understand hospice benefits, and really you can make this part of your human resources benefit package that hospice is available, they won't have to do that. They can allow their loved one to be at home. We can provide services. In some situations, we can even offer a homemaker to come in to kind of balance out any additional homemaking services that might be being given by the Department of Aging, for example. So please consider, give us a call. Again, that number 708-499-3400. That's 708-499-3400. Again, we will be on CAN-TV for the next 9 weeks. Next week we will be on with our chaplain, and she will be educating on bereavement as far as hospice goes for individuals who are going through that bereavement period. We are here to educate. We are not here to sign one up for hospice, so that's good news right now. But if you know someone who could benefit from hospice care, we want you to consider a Touch of Grace Hospice. Again, hospice is covered under Medicare, Medicaid, and private insurances. So there's never any out-of-pocket expense for your loved one or your family. I've been to Walgreens lately. It's pretty expensive. Any medical equipment, even oxygen, medical supplies, pads, diapers, all of those things are provided, so there's never any out-of-pocket expense. Earlier in this program, we had a caller call in with a testimony on all the services that she received, and even now she's still receiving support from a hospice group. So hospice is more than just someone is dying or someone is ill. Hospice is there to provide comfort care. Our chaplain educated me on hospice being a hospitality, and indeed it actually is. We're there to provide care and support when someone is declining in health or terminally ill. Now, during this last 23 minutes, we've been sitting here talking with Leah Lewis about the social worker's role in hospice care at A Touch of Grace. A Touch of Grace is located at 8250 South Cicero in Burbank, but we service the Chicago metropolitan area. So if you know someone who can benefit from hospice care, we encourage you to give us a call. But right now we have a caller on the line. Caller, thanks for watching and listening. What is your comment or question?
Okay, my comment is, hello to you both.
Hello.
I've been widowed for 5 months now.
Okay.
And I had hospice. I had Vitas.
Okay.
And I just wanted to throw it out there to everybody. You all are angels. You really are. You come in and do what you have to do, and I feel very comfortable with it.
Oh, good.
Yes.
Thank you for calling and sharing that testimony, and hopefully someone will be encouraged to seek the help when they need it as well.
Right.
Okay. Thanks a lot. Have a good evening.
You too.
Okay.
Bye-bye.
Again, our lines are still open. We have a few more minutes left. That number is 312-738-1060, or you can visit our website. You can visit our website at www.touchofgrace.net, or our phone number is 708-499-3400. Leah, I want to thank you for joining us tonight. I hope viewers, you have a better insight on the role of the social worker in hospice. Again, if you know someone who can benefit from hospice care, I encourage you to let them know about A Touch of Grace Hospice. Again, visit our website at www.touchofgrace.net or call us at 708-499-3400. We will be back next Tuesday at 6:30, and our guest will be our chaplain, Pastor Anita, and she will educate us on bereavement. Thanks again for watching, and have a wonderful night. Good night. Thank you, Leah.
You're welcome.
Good job, good job.
Sorry, that was